everybody. This morning we take you to General Physicians PC's Women's Health out in Synder. And this morning we're catching up with Dr. Armen Kirakosyan. Good morning, how are you?
Good morning, good. How are you doing?
Very well. Well, today we are talking about urogynecology. Just to start, doctor, what does a urogynecologist do?
Urogynecology is a subspecialty within general obstetrics and gynecology, and it mainly focuses on female pelvic floor disorders. So in order to become urogynecologist, after you finish and complete your OBGYN residency and get your board certification in general OBGYN, you gotta obtain special additional training and additional board certification to become subspecialist.
When women come to you, what are some of the conditions that you treat? Why would they come here?
The main problems that we're dealing with are pelvic organ prolapse and urinary incontinence. But it's not only limited to that. We also deal with urinary urgency, overactive bladder, painful bladder syndrome, problems related to bowel movements like constipation, fecal incontinence, painful intercourse, and problems related to previously placed vaginal meshes.
Okay, so why do some of these problems occur?
We believe that the main reason why people develop like prolapse and urinary incontinence, specifically stress urinary incontinence, could be related to prior damage that happened to pelvic floor muscles and ligaments, specifically during deliveries, specifically vaginal deliveries and big babies. Unfortunately, those events can predispose women to developing this type of problems later on in life.
All right, so if women come here, let's talk about a consultation. Talk us through what that's going to be like.
So usually consultation starts with the interview. So we have very thorough discussion about patient symptoms. We discuss prior medical history. Next step is usually physical examination, and urogynecologic physical examination is slightly different from general GYN exam because we need to assess a little bit more structures like pelvic floor muscles, ligaments, strength of the muscles, and assess a degree of the prolapse or incontinence if present. After that, we usually sit down and discuss options and have a specific individual treatment plan for each patient.
So you're telling me you should do more than just visiting your OBGYN. You should definitely make a stop here too.
That's exactly right.
All right, so once you've come here for a consultation, how often should you see your urogynecologist?
Well, usually it depends on the problem. So if we have some ongoing issues that we're trying to correct and we need a follow-up, usually I see my patients every 2 to 3 months to make sure the treatment is working for them. If we end up performing reconstructive surgery, once they're healed and everything is well, they can go back and see their general OBGYN.
Yeah, so let's talk about the upcoming seminar you have planned for everyone. What can you tell us about it?
Well, it's going to be events that we are planning at our Maple office. We're going to be talking about urinary incontinence and pelvic organ prolapse. It's going to be free for our community. Everybody is welcome. So I'm going to try to delineate in more details about the problems that we're dealing with, things that we normally do in terms of treatment of those conditions, and try to answer as many questions as I can.
Well, Dr. Armen, thank you so much for having us here this morning. All right, so for more information on their upcoming seminar and to learn more about women's health in general, make sure to visit GPPC online today.